Good morning, Brian, and welcome to the Back9Boys Golf Show.
Good morning, Rich. Thanks for having me. It's great to be on.
It is a pleasure. First off, I want our listeners, you've got a great name for your business, but what is Restoration Spine and Golf?
So Restoration Spine and Golf is restoring and improving the function and movement of the human body to allow golfers to play their game pain-free and with improved performance. So I utilize innovative manual therapies and neuromuscular re-education to achieve this.
In order to improve your golf swing and have it be pain-free, what do you recommend as far as someone using your services? As far as how many times do you want them to come to you?
Well, every individual is different. So I say every individual is N equals 1. So it's dependent on how many different issues they have that may be contributing to the dysfunction of their musculoskeletal system. But, we can get stark improvement in one session, Rich.
Okay, that's important. So what's the difference between the type of spinal manual therapy that you use on your clients and regular physical therapy or chiropractic care?
Great question. So the particular spine manual therapy that I utilize is Dutch in origin. Two Dutch physiotherapists invented this treatment philosophy and technique. And basically what it is the spine joints. There are 24 movable segments in the spine, these facet joints that should all distribute the loads and forces through the spine as we move, as we rotate, as we bend,
right,
forward, backward. So what happens is we have certain segments that lose the normal motion and function due to a neuromuscular reflex called the arthrokinetic reflex. So what's unique about this manual technique that I use to restore function to the spine is we're treating this neuromuscular reflex. Traditional physical therapy, chiropractic, osteopathic manipulation doesn't address this reflex.
Okay. And why is this so important to your golf swing? A lot of people really don't know what is and when are they in good golf posture so they're not going to hurt themselves, especially in their lower back.
Well, it's extremely important to have, good curvature in the lumbar spine. So what we typically see with our golf population is we see that the lumbar spine becomes overarched in the lower back.
Okay.
And when that happens, we have excessive loading of these facet joint capsules. And over time, that can cause injury to the capsule, which then initiates this reflex that begins to limit the motion at many of these segments. So now as you're rotating through your golf swing, you can't distribute the forces and loads throughout all of these different segments. So you have focal areas that begin to take on too much stress. So you can have, disc herniations. You can actually have pain from the injury of the joint. You can irritate nerves and have sciatic type symptoms. So there are a lot of things that can go wrong when you lose the function of your spine, because you then have to compensate everywhere else in your body for that lack of spine motion.
All right. A lot of the pros, when you hear somebody's withdrawn or somebody has, not going to this tournament, they're having some back issues. That seems to be, from what I've heard, one of the, besides the knees, but the back seems to be one of the biggest issues as far as injuries to these pro golfers who are just trying to kill the ball almost on every swing.
Yeah, it's the biggest, along with amateur golfers as well. So it's extremely important that, we do have correct posture, position, and then we have the function of all of those segments, that they can all move, because our spine was designed to, again, distribute those loads and forces. So when you're lacking motion at many of those segments, it's usually just a matter of time before you're going to start to have pain, but you'll immediately have a reduction in your range of motion, your ability to rotate, your ability to bend. So you'll notice, that you have stiffness with certain movement patterns,
Right, right,
in particular your golf swing.
right. So how do we know that we're in the correct golf posture? I mean, we go out there, we're playing well, we're really not thinking about, we just think we're in the right posture, and we may not be. So
That's
how
a
do we know when it's right?
great question. Well, we know video is extremely helpful, but just, having the basic understanding of that the lumbar spine, as we bend forward to set up to the golf ball, the lumbar spine should be bending
Right.
forward. We call this lumbar flexion, not extending the opposite direction, which would be overarching that lower back.
Okay.
So having that understanding, but then actually having the joints being able to move to allow you to do that is key. So video is helpful. Your golf instructor becomes extremely important in monitoring that. And, obviously your physical therapist needs to be able to restore that and teach you the correct patterning on bending. Because, we don't just bend to set up to the golf ball, Rich, but we're bending all day to pick stuff up. So we want to do it correctly using our abdominals. We should feel tension, slight tension build up in the abdominals when we bend correctly. If we do it incorrectly with too much extension in the lumbar spine, we will feel the back muscles engage, and those abdominal muscles aren't really working at that point.
All right. So are we supposed to bend at the waist with our spine forward and then stick our butt out, so to speak? Because a lot of instructors will say, pretend you're sitting on a chair. Or should we stick our butt out and then bend over?
Great question. When you're first relearning the correct flexion pattern of the lumbar spine, I suggest, first getting the initial bend, essentially the first 30 degrees of bend first, and then hinging from the hips. Because if you hinge from the hips first, what I typically see is you'll go right into that lumbar extension pattern.
Right.
After you've done it and practiced it and really drilled it in, and it becomes a habit, you can then have a better flow in your pre-shot routine and flow right into the setup and combine the flexion with the hinging pattern.
Well, I know you've got a website. I don't want to forget, but I want you to give us your website so our listeners can go to it, because what you're saying as far as the golf swing could help prevent injuries or prevent the injuries they've already had to go further, and plus have a chance to come to you to get it fixed.
That's correct. And also improve performance as well, because, if you're locked up in your spine, you may not be having pain yet, but your performance is definitely going to be hindered. So you can find me at restorationspinesportamelia.com. You can find me on Facebook and LinkedIn
as Brian Paxton.
Brian Paxton on LinkedIn, or also Restoration Spine and Sport, Restoration Golf on Facebook and LinkedIn, Rich.
Okay. So when people come to you after they've looked you up and everything, I'm sure one of the things that you go through, because you and I kind of talked about it, we went through a short session. Yes. What stretches do you recommend prior to playing? Because a lot of guys, man, I just drove up, I didn't have time to take a swing. I've got to hurry up and get to my tee time. They just drive up, get the clubs, go to the tee, and then don't understand why they're not stretched out because they haven't taken the time.
Yeah, great question. If you're limited on time, what I suggest is moving the joints of the spine through their full range of motion in the pelvis. So what it looks like, and a lot of people have seen something similar if they've ever done yoga, but we're rolling the pelvis forward, arching the lower back, and then rolling the pelvis back under and flexing. So we're going back and forth, and you can do this in the golf cart.
Okay.
And then to facilitate rotation of the pelvis and the hips, what we want to do is stand. You're going to put your weight predominantly on your front leg, and your back leg is basically going to be a kickstand like on a bicycle. And you can put your hands on your pelvis and just work on rotating that pelvis over the fixed leg here in front, back and forth. And this is a great activity because you'll actually warm up the muscles of the lower body and the hips and begin to facilitate that rotation. So these are two great activities that you can do, one in the cart, one while you're standing on the tee, waiting to tee off.
Does standing up and then pretending to sit down maybe 5 or 6 times, is that also part, or could that be part of your pre-round workout?
Yeah, that's a great way to just warm up the lower body. But you'll find that with that standing rotation, Rich, you'll feel a very good warm up in your lower body and hip muscles as well.
So when someone comes to you and you've gone through your assessment, what is the most common assessment as far as what they need to improve?
So typically, most of my golfers, they're lacking in the lower lumbar flexion, meaning they can't bend at L4, 5, and 5-1. Those are extremely important joints because at L5S1, that's where we should get most of our bending. So when you lose the bending capability, you lose the rotation as well, because these are coupled motions. What I also find is restriction in hip rotation, typically restriction in hip internal rotation. So we're going to address that as well as the spine, because the hips, as we know, are extremely important in the golf swing.
And back injuries, lower back, whatever it is, take a while when you do injure them. Some people come back a little bit too quick.
Yeah, that's correct. It's kind of like a sprained ankle, Rich. If you sprain your ankle, your orthopedic physician or your PT or your chiro, they're going to recommend that you have a period of rest before you go back out and jog on that ankle. It's no different when you injure the spine. You have to give it a little time to heal, but you do want to move those joints. And that's where a lot of people get in trouble, is they stop using those joints that are injured, and then they begin to compensate when they get back to swinging the golf club.
Yeah, and that becomes an issue because sometimes, as we just said, some people come back too quick and they don't stretch properly. All important. Give us the website again, Brian, please.
Yeah, it's restorationspinesportamelia.com. And you can reach me at 904-441-2667. My home base is Amelia Island. I treat St. Simon's Island. I treat in Jupiter, Florida as well. So you can see me in any of those 3 locales.
Well, Brian, thank you for being with us. I learned a lot. I hope our listeners did as well. And I hope you can help a lot of us